video is a continuation of the previous video in which we had learnt about the various risk factors, causes, complications and the types of hypertension, the hypertension treatment guideline, that is when to initiate treatment, how much to lower the blood pressure. Today I will be talking about the normal blood pressure regulating mechanisms and what happens when these regulatory mechanisms get compromised. Blood pressure is normally regulated by compensatory changes that occur in response to changes in cardiac demand. Various neural and hormonal factors influence and regulate blood pressure. These include, firstly, the baroreceptor reflex mechanism. Second, the renin-angiotensin-aldosterone system that regulates the blood pressure, blood volume. Thirdly, the hormonal factors such as insulin, adrenal cortical hormones, aldosterone, thyroid hormone and so on. And lastly, the vascular endothelium that regulates the release of nitric oxide that regulates blood pressure. The first one is the baroreceptor reflex mechanism. What are baroreceptors and where are they located? Baroreceptors are stretch receptors that are located in the carotid sinus, a small dilatation in the wall of the internal carotid artery. They are innervated by the glossopharyngeal nerve. The second set of baroreceptors are located in the wall of the aortic arch and they are innervated by the vagus nerve. So how do the baroreceptors function? Baroreceptors play an important role in the short-term regulation of blood pressure. They respond to changes in blood pressure. For example, in postural hypotension or hypovolemic shock, when the blood pressure falls, there is decreased stretch of the baroreceptors. So this decreases the firing rate from the baroreceptors. The neural impulses are sent to the vasomotor center that is located in the brain stem, and the vasomotor center stimulation can activate the sympathetic system and inhibit the parasympathetic system. So activation of sympathetic system causes increased release of norepinephrine from the sympathetic nerve endings and epinephrine from the adrenal medulla. Both norepinephrine and epinephrine acts upon the alpha-1 receptors of the smooth muscles of the blood vessels, increasing the total peripheral vascular resistance, resulting in a rise in blood pressure. Also, the beta-1 receptors of the heart is stimulated and this increases the contractility, increasing the heart rate. This increases the stroke volume, cardiac output and the blood pressure rises. So when the blood pressure falls, there is decreased stretch in the baroreceptors. This results in increased sympathetic system which raises the blood pressure. Also there is simultaneous inhibition of parasympathetic system. So decreased stimulation of the parasympathetic system causes decreased release of acetylcholine into the synaptic cleft. If you remember, the action of acetylcholine on M2 receptors of the heart decreases or slows down the heart rate, decreasing the contractility, decreasing the cardiac output. So when there is inhibition of parasympathetic system, reduced acetylcholine action also increases the heart rate, the cardiac output and the blood pressure rises. So when the blood pressure falls, the baroreceptors respond to changes, activating the sympathetic system, inhibiting the parasympathetic system, and the events that occur causes a rise in blood pressure, helps to restore the blood pressure to normal. So any disruption in the baroreceptor reflex mechanisms can cause alteration in blood pressure. The second compensatory mechanism is renin-angiotensin-aldosterone system. Renin-angiotensin-aldosterone system is a critical regulator of blood pressure, fluid volume and electrolyte balance. It plays an important role in long-term regulation of blood pressure. Renin is secreted from the kidney when the blood pressure falls or decreased renal blood volume. Sympathetic activation also causes increased renin release into the circulation. Renin is secreted by the kidney in response to decreased blood pressure, decreased renal blood volume. Sympathetic stimulation also causes increased release of renin into the blood circulation. Angiotensinogen is synthesized in the liver and it is converted to angiotensin 1 in presence of renin and angiotensin 2 in presence of angiotensin converting enzyme. So what are the actions of angiotensin 2? Angiotensin 2 is a potent vasoconstrictor of arteriolar smooth muscle which increases the peripheral vascular resistance, increasing the blood pressure and restoring the blood pressure to normal. Secondly, angiotensin 2 stimulates the adrenal cortex which causes increased release of aldosterone. And what is the function of aldosterone? It increases the reabsorption of sodium and water and excretion of potassium. So aldosterone release increases or retains sodium and water in the body, which increases the fluid volume, the blood volume increases, the stroke volume increases, and cardiac output increases. Thirdly, angiotensin 2 binds to the AT1 receptors that are present in the hypothalamus and stimulates the thirst center. This increases the water intake and increases the fluid volume in the body and helps to maintain blood pressure. Also, angiotensin 2 binds to the AT1 receptors of the posterior pituitary and stimulates water retention in the kidney by adding water channels in the collecting duct. So, angiotensin 2 action helps to retain water and increase the fluid volume and helps to maintain blood pressure. In addition, angiotensin 2 has direct action on the proximal tubules. So this is the site where maximum excretion of sodium and water takes place. So through angiotensin 2 action on the proximal tubule, there is retention or inhibition of sodium and water excretion, and this helps to maintain the fluid volume. So angiotensin 2 through various mechanisms causes vasoconstriction, increases the peripheral vascular resistance, maintains fluid volume, increases the water intake, and helps to restore the blood pressure to normal when the blood pressure falls or when the renal blood flow decreases. So the opposite effects are seen when the blood pressure rises. So this is how the angiotensin 2, this is how the renin-angiotensin-aldosterone system helps to regulate blood pressure, and overactivation or dysfunction of renin-angiotensin-aldosterone system leads to chronic hypertension. Next is the hormonal factors such as insulin resistance, thyroid disease, adrenal cortical hormones, aldosterone secretion influences or regulate blood pressure. Insulin resistance and hyperinsulinemia is frequently associated with coexistence of hypertension, hyperglycemia, dyslipidemia, obesity, and together this is known as metabolic syndrome. Thyroid disease or hyperthyroidism causes activation of sympathetic system and upregulation of sympathetic or adrenergic receptors, resulting in increased sympathetic activity. Also, excessive aldosterone secretion and excessive cortisol production in the body causes alteration in blood pressure. Therefore, control or treatment of hormonal factors is important to regulate and maintain blood pressure. The next is the vascular endothelium that regulates the release of nitric oxide. Nitric oxide is synthesized in the vascular endothelial cells and diffuses into the smooth muscle. In presence of guanylate cyclase, it increases the cyclic GMP formation which causes vasodilatation and relaxation of vascular smooth muscles. So nitric oxide causes vasodilatation, decreasing the blood pressure and helps to maintain the blood pressure when the blood pressure rises. Most patients with hypertension have an inherent deficiency of nitric oxide, and this results in inadequate vasodilatation, and this contributes to hypertension and other vascular complications. To summarize, the various regulatory mechanisms are the baroreceptor reflex mechanisms that is responsible for the short-term regulation of blood pressure, the renin-angiotensin-aldosterone system that is responsible for long-term regulation of blood pressure, the hormonal factors, and the vascular endothelium, and these regulatory mechanisms together help to maintain and regulate blood pressure. Any dysfunction or alteration in these regulatory mechanisms can lead to adverse changes in blood pressure. Thus, knowledge of these mechanisms is important to understand the antihypertensive drug therapy. So with this, we come to the end of this topic. In my next video, we will learn about the classification of antihypertensive drugs and the various mechanisms that help to lower the blood pressure. If you like this video, please like, share and subscribe. See my book, Case-Based Learning in Pharmacology, which is published by CBS Publishers and Distributors. I have also referred to other sources. The references are as shown in the screen.